Welcome to the MPH Lens. I'm your host, Brianna Y'all. Come learn as we dive into mental health conversations to help you better address your mental health challenges as a public health professional. The importance of applying mental health practices in your day-to-day routine can encompass a range of strategies towards promoting mental well-being, preventing mental health issues, and providing effective interventions for individuals facing mental health challenges. Public health professionals too often cross paths with mental health challenges when managing their personal life and professional life. However, today's goal is to provide resources on where to start. Hello, this is Brianna Yaw, Associate Student Contributor at the Public Health Millennial. Welcome to the MPH Lens, where we dive deep into all things health and wellness from the lens of an MPH student. Today, we will discuss how to prioritize mental wellness and still achieve your professional and educational goals. Joining us on today's episode, we have Theresa Alphonse. She will share her knowledge on mental health and how to implement healthy practices throughout your daily routine and get steps closer towards achieving happiness. Theresa Alphonse received her MPH and is a Haitian American public health practitioner who has dedicated a decade to promoting health equity and racial justice. With a degree from the University of Massachusetts Amherst and the University of Miami, Theresa has worked with health centers, hospitals, government entities, and nonprofit organizations to implement equity initiatives with a focus on racial justice. Her expertise and perspectives have been sought by various media outlets, including the Boston Globe, BET, and NBC 10 Boston. Theresa is a change agent, thought leader, champion, and influencer. As a trainer, consultant, and speaker, Theresa Alphonse possessed several competencies, including being a results-driven and strategic thinker, an expert in relationship building, and policy and systems change frameworks specialist. She also has excellent skills in cultural humility, sensitivity, and awareness, understanding structural biases, and can conduct root cause analysis to eliminate inequities in health outcomes. Welcome, Theresa.
Thank you so much for having me. Happy to be here.
Such a pleasure. So tell us a little bit about yourself and what does mental health mean to you?
Yeah. So you read my bio very eloquently, and I think it really captures my career thus far. As you said, health equity really is my overall focus, and the theme that brings a lot of my work together within the mental health space, within the health equity space at large, and also artistry as well. So I think mental health means to me um, being able to be mentally agile, mentally flexible. And what I mean by that is in our day to day lives, just by nature of being human beings, nothing's ever going to go according to plan. Nothing is ever going to be perfect. So I think being mentally healthy is being able to um, really bob and weave uh, in terms of
Mhm.
whatever life throws at you and having the tools and really the resiliency to be able to overcome various obstacles in your life.
Thank you for sharing that with us. And what are some common misconceptions about mental health that you've crossed paths with?
I think what I hear commonly is that mental health isn't as important as overall physical health. I think
Mhm.
it's almost priority for a lot of people to think about pain when it comes to the physical or different health outcomes. And we very much focus in the public health and the healthcare space on diabetes, hypertension, obesity, and things like that. But I think what's important for us to understand is that if our patient population, our community population, those that we're serving, aren't mentally healthy and don't have the behavioral health components aligned, then that is going to translate to them taking their insulin or
Mm.
getting the adequate amount of exercise that's needed to live a healthy life. So I think one of the greatest misconceptions is how linked mental and physical
Mm-hmm.
health is. And also what I've seen amongst a lot of just immigrant and Black communities is that mental health is not a priority and is not something of importance, and also negative connotations when it comes to using the phrase mental health and what that means. Oftentimes, I think we're pushing the conversation forward, and there have been, in my opinion, more conversations around normalizing uh, discussions regarding mental health. However, I do think there's also a long way to go because of how people view mental health. There's a
Mm-hmm.
connotation that if you address it, you talk about it, the mere phrasing of it means that someone is unwell, and often terms like crazy are used. So I think
Mm-hmm.
that is also another misconception that mental health is a vast spectrum of different diagnoses, different
Mm-hmm.
feelings, and different expressions, especially depending on what your lived experiences are.
Mm-hmm.
So I think there's just this automatic association of it being negative when that, in fact, isn't true. Everyone should be aiming to be mentally healthy and taking care of their mental health.
Thank you so much for that response. I love how you emphasize the link between mental health and physical health. A lot of people tend to neglect that being so in sync and in connection. There's so many behaviors that you can even because I work in health in the hospital, and
Mhm.
it's just you see that pattern when you tend to certain patients, their mental well-being or things that factors that they have to battle that contributes to how they show up as far as their health. um it does play a significant role, and it's just so important to prioritize that. And even going back to how you mentioned immigrants, my family who are immigrants as well, they're from Guyana. It's so common in the Caribbean culture for mental health and utilizing those resources to address those issues to be so taboo. And
Mhm.
I feel like it's just so important. I feel like especially in the Black community and in all communities in general, but specifically the Black community, it's just such a important conversation. um I feel like a lot of trauma is attached to our everyday experiences that it never gets communicated, or if it is communicated, it's done in a joking way. It's as far as addressing the issues, utilizing the correct resources to achieve your best well-being is so it's a conversation that needs to be emphasized more often. So I loved how you mentioned that. And
Mhm.
moving on, you founded What's on Your Minds Inc. as a nonprofit organization, and how it strives to normalize conversations around thoughts, feelings, and emotions um, surrounding mental health in communities of color. So, what has this journey been like, and why was that so important to you?
Yeah, I think I just really noticed in a lot of the work that I was doing this lack of outlets for people to have conversation. And I think a lot of what we talk about in public health is meeting people where they're at. And I felt like the way to do that was to do that in a very literal sense,
Yeah.
by going out into the street and talking to people. And once I saw that there was a reception, it really furthered my view and my analysis of the need for people
Mhm.
to be able to talk and express their thoughts, their feelings, and emotions. And from the initial conversations that I was having in Roxbury in Massachusetts, And in Harlem, maybe I think 6, 7 years ago, um, expanded the organization to include a podcast and in person events, as well as materials for folks to focus on mindfulness. Um, it's been quite a journey, as I discussed with you in pre production. Um, Running a nonprofit isn't the easiest thing, especially while you're juggling your career and then all sorts of other creative endeavors. So, and also the pandemic was a major factor in a lot of what we were doing being put on hold.
Mm-hmm.
What I think the organization did, at least in the time we were extremely active, was really plant seeds
Yeah.
and offer folks the skills and the tools to be able to not replace therapy. We didn't want to replace therapy by any means. I
Mm-hmm.
think there's so much importance in guidance and having someone who is trained to be able to coach you through
Yeah.
and give you assignments and give you support in a way that's evidence based. So, by no means did we want to do that. What we called our sessions were active listening sessions.
Mm-hmm.
And what we really wanted to equip people when it came to discussion with their friends and their family and loved ones, and even just people that they would meet spontaneously on the street, as we did with the initial conversations that we were doing, was really to just let people know that although we as individual beings don't have the end all be all and we don't have all the answers, we can offer listening. And
Yeah.
listening goes a long way, and being able to ask questions and having folks be the center for whether it be 5, 10 minutes or an hour in a conversation, I think is extremely important. And we had filmed some of these conversations and dropped a
Mm-hmm.
documentary in 2018, and that really was the consensus in a lot of these conversations was, wow, you really care about me, you stopped to ask how I was doing, or you ask questions about what sort of resources there are, and I want my voice to be heard. Particularly noticed a trend in a theme in Black men being super receptive to the active listening session. So planting the seed um, of one, centering other people as opposed to ourselves in
Mm-hmm.
certain situations, and also highlighting the really the violence of hypermasculinity,
Yeah.
specifically in Black culture, and just providing an example and encouragement for other people to take what we were doing in on social media and on this like very visible platform to low key conversations that they would just have in their daily lives. So um, yeah, I think we made an impact, and I hope to continue making an impact. And just like with anything, I think we need to allow ourselves to evolve. I think we need to allow organizations to evolve. We need to allow for our mission, et cetera, to evolve. So even as someone who led the charge in this work, I'm eager to see how we evolve what's on your mind in some of these conversations and these themes in my personal work and the work of the nonprofit moving forward.
That is so awesome. I love that you created this safe place and platform for people to utilize and take full advantage of, because I feel like, we have we're in a lot of people tend to respond just a reactive way, and I feel like it listening is just so key. It's so simple to do. Well, it's not as simple for everyone, but it is a
Yeah.
simple solution for people who really are in need, who are really
Hmm.
in need to voice their feelings, because I feel like oftentimes people just want to feel heard.
Hmm.
It's so easy for people's feelings to be invalidated or shunned, or their character to be kind of criticized on them feeling feelings. And
Hmm.
it's important to have these platforms and spaces for people to see that, oh, this is normal, this is okay for me to do, and that
Yeah.
we need to expand this because there is a significant need for this in all communities, but definitely in the Black community. um
Hmm.
so moving on, your book Happiness offers an inspiring and exploration on how daily habits have the ability to positively shape our lives. How has writing this book shaped your life and has impacted your mental health journey?
That's a really good question. So I wrote happiness when I needed happiness.
Yeah.
Um, Lots going on in the world, lots going on in personal life, just like every other human being walking this planet. And I think I was on a journey of really self discovery, and really honing into how do I, as Theresa Alphonse, without the name brands, in terms of my clothes or the car I drove or these linear markers of success that society has put onto us. So, removing all of those things, how at my core can I constantly embody happiness as opposed to chase it, right? So I took a course over the summer called The Science of Well-Being by Laurie Santos, from
Mm,
Yale University. And I think it was about a 10-week course that really looks at not just the psychology, but like the research behind
yeah.
and the studies behind what really creates happiness amongst
Mhm.
human beings. And I took that course and I thought the best audience to really take in this information would be children.
Yeah.
So I wanted to write something in a very simple format that really could be a checklist of if I maintain X, Y, and Z, then this is what could really fulfill me at my core, as opposed to constantly having happiness being fleeting, which was a core component of this course. Is that when we do have these things, referred to as stuff in the course, that doesn't necessarily make us happy. It might for that moment in time, but we tend to adapt to things. And this theory is called hedonic adaptation, where over time, once we get the house, we get used to it and it's not that big of a deal. And we might want
Yeah.
a bigger house after that. Once we get the car, we're driving around in the Tesla and the Benz. And then after a couple years, we're like, this old thing, let me get a Jeep or an Audi. And we are constantly in this cycle, and society knows that we're in this cycle. And that's why we get fed
Hmm.
these ideas of consumerism and that we need all of these things to be happy. And these things can make us happy, again, for a moment in time. Um, and the course also talks about how we can create newness out of these things that are old as well. But essentially, we can't focus and rely on this stuff, right? We have to focus on, really the core. And the core looks at making sure we're getting physical exercise daily. And in the course, each week you had to put into practice what the teachings of that week was. Because the
Wow.
idea is that just because we know better doesn't mean we do better, right? We're nearing like the beginning of the year. And a lot of people are like, well, I'm overweight. Let me get my gym membership. Let me start working out. I'm trying to be like hot girl for the summertime,
Yeah.
right? But then we all do it. And then by February, March, we're not in the gym like that anymore, even though we know that in order to get our desired goal, this is something that we have to do and this is something that we have to sacrifice. So, what's important for us is to create habits.
Yeah.
So, a lot of the course focus is on how we take the things that we know make us happy, like the exercise, like the gratitude, like the connection with your loved ones, all of those things. How do we make sure we build habits out of the things that make us happy? So put together the book, including all of those components, and then towards the end of the book, there is a journal, a weekly happiness journal that allows you to document, okay, today, who did I connect with? And then you can write in, I had a 30-minute phone call with grandma. I went on a walk with my best friend, etc. Did you move your body today? For 30 minutes, I danced around my room.
Yeah.
A core component of the work that I was doing and what I gravitated towards most and that I've made my daily practice is writing gratitude. And I found that over 10 weeks writing gratitude lists every single day. Yeah, so writing those gratitude lists definitely improved. So I really wanted to empower this next generation to hold on to really what their innocence in their core is too, because
Yeah.
I actually just saw a video on Instagram where they interviewed adults and asked them what they would change about their body, and the adults would be like, my nose, my forehead, I wish I had thicker thighs, and the kids were like, I wish I had a mermaid tail, I wish I had fins, or I wouldn't change anything about my body, I love my body. So I feel like
Yeah.
being able to impart that intentional education on young people so they actually hold on to their essence, not even really like we're teaching anything. Because
Yeah.
as a kid, I think a lot of us were active and outside and just saying, telling, hopefully, if we were from comforting households, telling our parents we love them and hearing it back and things like that. So, really taking the essence of what children are and hoping that they maintain that to maintain the happiness of youth. So writing the book was just a beautiful experience. I was like in the middle of like the jungle of Guatemala and like taking this course and then doing all of the things in practice. Um, and then also reading Rest is Resistance at the same time, I think was also important and integral. So Rest is Resistance by Trisha Hershey. She founded the NAP Ministry. And she's a Black woman that really talks about the importance and the revolutionary just ideology behind especially Black women being able to rest and take breaks, and what that looks like
Yeah.
for each one of us, whether it's just like deleting the Instagram app or taking a 20-minute nap every day, um, or just even finding a place like during work to just close our eyes and meditate for a little bit. So I
Yeah.
think all of those things kind of put me in a position to really dive deep into the core of myself and take those things and hopefully share that with a broader audience that will take away from it.
What a beautiful journey, honestly. You dropped so many gems in this response that I hope the viewers take full advantage of. I certainly most will. I love how, just to piggyback off of your last statement, I definitely feel like as a Black woman personally, it's it's like there's that guilt, that invisible guilt, visible and invisible guilt, when you take that additional time for yourself and not you catering to, your love to a bunch of other things that require your attention and demand. Sometimes when you reach your limit in the day or your capacity, it's so important to just be mindful to take those breaks, and that it is okay to take those breaks. It doesn't take away from your character, it doesn't take away how successful that you can be, it doesn't take away how great of a person that you are. Just to set that as standard, it it kind of is, it serves as a domino effect on how much love you show yourself, how much grace you show yourself as you continue to implement that into your routine and in your day to day. you feel like you're filling your own cup, you know? And you just dropped so many gems. I love it. I really appreciate it. Um,
Thank you.
so
I mean,
moving on.
one thing that I did want
Yeah.
to add that you touched upon was just like the giving yourself grace thing. So I also
Yeah.
coach several Black women who were early in their public health careers, early mid level, mostly program managers. And what I'm finding is we don't give ourselves grace.
We don't.
There's so much perfectionism, which is a byproduct of white supremacy.
Yeah.
But like the level that I'm seeing it in Black women is just ridiculous. Nothing we ever do is enough.
Yep.
When something doesn't go according to plan or is wrong, we beat ourselves up over it. So I think that that's a great point. I think we need to work on that. I think as Black women, as a collective, is allowing ourselves grace and allowing ourselves the ability to just like turn it off sometimes. We
Yeah.
don't always have to be with the cape and
Yep.
saving everything and leading everything. I find myself in positions where I'm always leading and I'm just like,
Yep.
how, which is great, and I think is awesome, because if you're gonna have someone do it, let it be a Black woman.
Yep.
um but yeah, I think that's something that we need to work on, so happy you called that out.
Yeah, I definitely feel like it's the driving force of what made me choose this too is because my personal experience with mental health, but not only that, just being in being new to the public health profession, working a full-time job and still pursuing my master's degree. And not only that, the more that I network with other public health professionals, I see and hear how they have so many like expectations that they have to meet, whether it's in their professional role, and just spreading that awareness and pursuing their passions. It's kind of like, when do we shut that off? And in being in that process, in the early stage of that process, I'm just like, I feel it now, and the feeling is not going to end anytime soon as I continue my career. And it's so important to just gain insight from other professionals who are already in it, people who've already experienced it, to gain a better understanding. Not only, you get so many takeaways from everybody's perspective and experiences, but the ones that resonate with you is how move forward and kind of serve your best self. So I feel like it's super important. It's super important to just know when to kind of just tend to yourself. I feel like it's just it's so common for people to overexhaust themselves, and
Mhm.
it's just not, we're human beings at the end of the day.
Yep.
I feel like a lot of people forget that. Um and I love that that we resonated with that. Um
Mhm.
so moving on, as a public health professional who wears many hats and fulfills many roles, how do you avoid burnout?
Oh, that's such a good question. It's really hard. I will
Yeah.
be transparent that it's difficult because public health is so broad. And if
Yeah.
you are someone that is invested in the just overall health of communities and larger populations, you may, like myself, find yourself just diving deep into
Yeah.
kind of everything that really aligns and is adjacent to it. So, like, I'm experiencing that currently with some organizing around Palestine, where I'm just like
Yeah.
going at 150 miles per hour, and
Yeah.
what I've had to tell myself is I cannot be involved in everything. And there are things that sometimes I have to decline to preserve myself.
Yeah.
And just again, going back to rest is resistance, is reminding myself that in the rest, it's not only that I'm resting to come back to be better at the work, I'm resting because I deserve rest.
Yep.
I'm
Absolutely.
resting because my ancestors didn't have the opportunity to rest. I'm
Absolutely.
resting because work was forced upon my ancestors.
Mhm.
And rest is not a luxury, it's a human right
Yep.
as a person. And oftentimes, what I find too is when I do have the opportunity to rest, I come back to the work with a fresh set of eyes and
Mhm.
ideas, and I'm able to work through some of the problems um, that I had prior to resting. And then after I rest, I realize they're not necessarily problems because I have a different strategy and a different outlook to those things. So we want to stay away from burnout when it comes
Yep.
to the cause. Burnout is not going to get us anywhere faster. In
Yep.
fact, it's going to delay our process into getting to the destination that we're working to get to. And I think society has really put hyperproductivity on a pedestal. And
Mhm.
I think a lot of that is intentional and by design, and that when we are resting and we take a break and we step away from the work, we are able to really dig deep into the most imaginative parts of our mind to
Mhm.
rethink what um, society has created. And that's really, I think, our work as public health professionals, is to look at these systems of oppression, whether white supremacy, patriarchy, um, all of the things, and look at how we reimagine the world for our communities and different populations, whether we're focused on the immigrant population or the elderly or young people or whatever it is. And I think you're doing yourself a disservice by not taking breaks and falling into the traps of capitalism by burning yourself out.
Yep.
That's what the system wants. The system wants us to burn ourselves out. The system wants us to continue to prop up these healthcare systems that don't work. But when I take
Yep.
a break and I have time and I step away and I come back, I feel more like I feel more myself to be able to take the
Yeah.
work head on. I feel more able to look at the different structures and say, hey, this is not how it's supposed to be. And really the goal in I think resting at an individual level is to allow populations the ability to rest as well. And
Mhm.
when I say that, it's we want to alleviate populations from having to worry about when they're getting their next meal. We
Yep.
want to alleviate populations' worry about being able to afford medications. And
Mhm.
when we sit in a position where we are able to live what we want for our populations, we're able to direct the system in getting to that place better because we have to know what we're striving towards, right?
Yep.
I think when we talk about overall health equity, we're talking about everybody having an equal opportunity and chance at life. And I look at, what are the people who are in that 1%? What are they experiencing? What are their day-to-day lives? And what is it that we want to introduce and show to other populations that their lives have been absent of because of all of the systems that I've talked about. And I think a lot of that really is freedom. A lot of that
Yeah.
really is rest. So we need to embody that so we know where we're taking people and what
Yeah.
journey we want to get to and what destination that is. And that is for me to be able to look at different populations, whether it's people doing active physical labor. I'm in Mexico right now, so I'm thinking about the indigenous folks that
Mhm.
are breaking their backs to make sure that I have what I need while I'm here. And what I want for them is freedom. What I want for
Mm.
them is rest. So I think that was just a long way of saying that we, in order for us to get to where we need to get, we can't be burnt out
Yeah.
on various different levels. So I think we need to start changing the narrative of me being hyper productive and in grind mode all the time
Mhm.
as this positive thing where it's like, I think we should really uplift balance in our lives. And that's what we
Yes.
should really be promoting and celebrating, is the person who has balance, right? The
Yeah.
person who has the ability to get things done, but then also escape for a week and you don't hear from them. But
Yeah.
the work is still accomplished, the work is still
So
there, and
true.
they're going to get back to the work. So yeah.
Such a powerful statement and such a great way to transition. Such a great way to end our interview. But before we officially conclude, I just want to get into some rapid fire questions that I have set for you. Um, what are you working on improving in your life right now?
What am I working on improving? uh that's a tough question. I just, so I think related to what we just talked about, I think whenever I see an opportunity for a creative project, I have to do it.
Hmm.
And it's funny, like, so while I'm in Mexico, I was telling my mom, like, hey, I want to really connect with the refugee Haitian population here, because this is a stop as folks travel through
Hmm.
Central America to get to the Texas Mexico border. And these are stories that I think a lot of people want to hear, and all of that. And mom's like, another project? Like, you wrote a book this year, you dropped a course, you organized this like solidarity event in Little Haiti in Miami with
Awesome.
Palestinians, and like now you want to like do a whole little like Anthony Bourdain style documentary with
Not Anthony Bourdain.
refugees. And
Oh,
I'm just
goodness.
like, you're right. But I'm like, also like, it would be so cool. Like,
Yes.
so I think it's just like trying to figure out what to do now, what to do later, what not to do at all.
Yeah.
I think is difficult because there's just so much that the world needs. But I also have to remember, as a public health professional, and I'm sure you and a lot of folks have heard this analogy, we have to think about our work as this constant running river.
Yeah.
And there are people in the river that need our assistance, but there are people down at the bottom of the river pulling people out. There are people at the top preventing people from jumping in. There are people throwing out life jackets. Like, we
Yeah.
all have a role, so I don't
Yeah.
have to play every single role.
Mhm.
Is something that I need to remember and work on.
Thank you so much for sharing that. And one last question. Any final tips that you would recommend for MPH students that would best support their mental health?
I would say gratitude lists. I
Yeah.
know I talked about that in the beginning, but I think it's something so low level that you can commit to. With the like going to the gym,
Yeah.
there are barriers of being able to afford a gym membership. Sometimes you have to drive. In today's society, you have to have the cute clothes and all of these
Yeah.
things that might prevent you from wanting to go. But I think gratitude lists have a very low level of intensity, that all
Mhm.
you need is a pen and a paper and you can really write everywhere. And you don't even need that. You can start writing notes in your iPhone or whatever
Yeah.
phone you have, and use that daily. So that would be my recommendation. And then also, I think your community. in grad school is really important. So really look to the people that you're studying with, the people that you're hanging around with, the people in your classes, and even the support system of your friends and family.
Yeah.
I think is really important.
Thank you so much for sharing those gems of tips. And that concludes our interview. Um, is there any platform that the audience can connect with you that you would like to share with us?
Yeah, you can follow me on Instagram at Theresa Alphonse MPH, just my first last name MPH. And I'm also on TikTok. That's my less
Yeah.
professional side where I talk about whatever. And that's not a professional on TikTok.
I love the emphasis. Well, thank you so much, Teresa, for joining us on today's episode. It was such a pleasure talking to you. You dropped so much knowledge that I hope that the audience is able to take full advantage of. I know I certainly will. So that concludes our episode of the MPH Lens. Be sure to subscribe so that you can stay on the know when we dig deeper into mental health conversations, and be sure to share with the MPH student you think would benefit from this. Thank you so much for watching.